Good afternoon, everyone. I'm Gary Summers, and welcome to the audio edition of Mind, Body, Soul. I have with me a very special guest, Dr. Kathleen Mercer, who's a doctor of naturopathic medicine, and who's going to come here and talk about some of the things that we can do as we work our way through COVID-19. Welcome, Dr. Kathleen.
Thanks for having me, Gary.
So, Kathleen, I guess the first question, and when we hear about naturopathic medicine or a doctor of naturopathic medicine, there are myths out there about what a doctor of naturopathic medicine does. And I guess for me, and I'll just start and just lead this in, when we talk about an undergraduate degree, whether that's science, which you also have, and things like that, it normally about 200 hours a semester. So 400 hours times 4 years, that's about 1,600 hours of training that a person who goes to a university or a college would get from that. Your training is over 4,000, not counting your science degree, just for your naturopathic medicine, that doctor that you have, you're well over 4,000 hours. So when people come to see you, they're coming to see someone who is well trained, who's well versed, who's gone through as much training and more than anybody else can. So can you just talk a little bit about what naturopathic medicine is and what it is, and what are some of the things that you do on a daily basis?
Right. So yes, it is quite a serious endeavor for taking it on educationally. You do need a degree first with all the pre-medical sciences, and then we go on to one of the specialized schools in Canada or North America, and it's a 4-year program, and then we have at the end is a year clinical residency, and then there's board exams and continuing education, and it's a well-certified program that we all go through, and it's 4 years of quite intense for the educational part, and then the residency at the end. So we're well educated and we're well trained to be a health practitioner in the community, as in partnership with all the other healthcare practitioners that a person should have. And I always say that, each individual should look at themselves in the center and think of all the healthcare practitioners they have around them that help to keep them healthy. So that might be your dentist, maybe it's a social worker, psychologist, your MD, maybe you've got some specialists, and then we all should have other ways of taking care of ourselves. Hopefully a naturopathic doctor will be in that, massage therapist, acupuncturist, chiropractor. There's so many good healthcare practitioners that you can have around you that help you be the best you can be. And in Newfoundland, there's only a couple of us here. There's 3 of us. And because there's only 3 of us, we consider ourselves as general healthcare practitioners. So that means basically, Gary, in one day, I could see someone dealing with some mental health issues. I could see somebody who's dealing with fertility. I could see somebody who's looking for extra support for their immune system. I could see someone who's dealing with weight loss. I could see someone who is dealing with cardiovascular illness and looking for extra support. So I always say we have a really good intake with our patients. We deal like an hour and a half with our patients, so that we get time to really lay out what's going on with the person's life and their health and their lifestyle. We go through everything from basic health care to what medications they're taking, how they're sleeping, if they're happy, how are their relationships, do they have anxiety, what do they eat, so how often they go poo. Like there's, most patients leave my office and say they've never given such a thorough, had an opportunity to give such a thorough description of their, lifestyle and body and mental health.
So yes, because it's like you said, to become the best version of yourself, because it does require so many different aspects of your life, and if one is kind of out of kilter, and I always say, if someone tells you that there's nothing more that they can do for you, that just means that there's nothing more that they can do for you.
That's a good point.
There are so many other people, because we only know what we know. Right? We don't know what we don't know. And
right.
you may, and that's why I did this series, is because I wanted to introduce people to so many wonderful people, and when people listen to these interviews, they may listen to somebody who could change their life, because there is a solution to every
Mhm.
issue. We just need to figure out and be strong enough to continue to look for it until we can find it. So,
Absolutely. And you know, Gary, the other thing is a lot of people might write on their intake form when they come to see us and say they're coming to see us for migraines. And by the end of the hour and a half, you know, the bigger piece of my recommendations for them is about their relationship with their, you know, teenagers, or their relationship with their partner, or that they don't like their job. So they thought they were coming in for migraine, but when we really unravel it down to root cause, you know, the stress of a difficult relationship might be the biggest piece that we need to address, as opposed to maybe they were thinking they were going to get a herbal remedy or, you know, some minerals for their migraines. Instead, we're actually talking about some really root cause stuff that might be really at the base of what's going on with their migraines or headaches.
and that's why when you say 90 minutes, people who come in and they think they know what they want, but they really don't know what they need.
Sure.
And
Yep. All of us.
that's your job to try and figure out what they need. So let's get into talk about the big picture and how COVID is affecting our health.
So I have found this time to be quite educational for me, um, in observing myself and the people around me, as well as my patients, in how COVID is affecting us. And I think some things have happened that people wouldn't have expected. So, you know, from a negative point of view, when we all found out in March what was going on with COVID, of course, there was shock and fear, and shock was real. Like, a lot of people went into a form of emotional and mental shock. Um, I think it brought up a lot of anxiety for people who maybe had never experienced anxiety before.
Well,
Anxiety about,
is
go
that
ahead.
fear of the unknown, right?
I was just going to say that fear of the
Yeah.
unknown, the virus was unknown, what was going to happen was unknown, job and money was unknown. I mean, there was a lot of really scary stuff, and people really felt shock and anxiety. And I had some interesting experiences with patients who had an experience with anxiety throughout their life. Actually, a lot of them handled this very well, but people who had never ever labeled or discussed anxiety in themselves, those people had a harder time with it, because it was an experience they've never experienced before, to have this type of anxiety. So it was really, I found that really interesting.
And you
Um,
know, that brings up a good point, Kathleen, is to be able to figure out how you can constructively express your feelings. You know, when you feel off, when you don't feel right, bottling that up is probably one of the worst things that you can do. So the people who are used to dealing with anxiety, dealing with issues, dealing with problems in their lives, this is just another thing that they've learned, that they've been able to go through other ones in their past. So this is another one that they'll be able to go through, as opposed to the people who tend to push their problems aside and hope that they'll go away.
yes, absolutely. I think that was a big deal for a lot of people. The other part of it, Gary, I think that brought up from a negative point of view was, you know, loneliness and isolation for a lot of people, and which has led to quite a bit of increase in depression in our community. If we think of certain groups of people, people who live alone, people who are single, some of our elderly, you know, really shut down our lives, as we all know. But I think the isolation and loneliness really hit on people, for sure.
Kathleen, I read a study, and they followed, I think it was 300,000 people over a span of 30 years. And they came up with the top 10 uh, contributors to longevity, and the ones that you would see there would be, you know, high blood pressure. If you know, if you have normal blood pressure, cholesterol is normal, you don't have any heart disease. But there were two that were the top of that list. Diabetes was one, and on and on and on. You know, cardiovascular issues. But the one that was in the top two was social interaction.
Mhm.
having friends, being out with friends, having to being able to go out and have a coffee with people. So when that gets shut down,
Mm-hmm.
that's a big stressor in itself, isn't it?
Yes, for sure. Absolutely. It was a big piece of this and still is a big piece of this, because some people have become depressed and then still are in that and not knowing how to get out of it. And some other people, I think, I always say we got to a point in COVID at the beginning around April, May, when we realized this was real and we were staying at home. You know, you can't avoid yourself. All our distractions were gone. A lot of them were gone. And it's like a lot of people started to really watch their own behaviors or feel their own feelings that they were distracting from before in the busyness of life. So, you know, a lot of hopefully people could hold on to that and use that as tools to start to work on themselves and figure out what they wanted to do to help themselves live a better life.
For a lot of people, I would think that this has probably been one of the biggest stressors that they've been through
Yeah.
for this long a period of time.
Yep, for sure. And the other negative, I think, I mean, there's a lot, but the other one, which is some people think it's kind of funny, and maybe it is, but you know, everyone started drinking more.
Yeah.
And I mean, most people, not everyone, a lot of people started drinking more alcohol, and a lot of people started baking, which is great. I mean, I love that from one side because you think about people getting to the roots of baking and food culture and kids learning how to bake. That's beautiful. But the other part of it is everyone was eating it.
Yeah.
So, you know, most people we know gained weight during COVID, which we laugh at and we think is funny. But, you know, this might continue through winter's coming,
Yeah.
and it might be a tricky situation for people.
Yeah, you need to figure out a healthy alternative. You know, when I see people for smoking, one of the things I say now, you need to replace smoking with something that's healthy. You know, you don't want to replace that with eating more or drinking more. You want to replace it with something that's going to help you, not hinder you. So Kathleen, what have we learned as a community through COVID?
Well,
Because there are lessons to be learned here, right?
absolutely. I mean, I think the negatives we just talked about were one thing, but the other feedback that I received from people is that so many people said, you know, Kathleen, I hate to say it, but I needed a break. Or during COVID, I've been thriving. And almost they don't like to say it to people because it sounds strange, but a lot of people really needed a break. So I do think people, and I hope people remember this and therefore make life change, is that people did like the time and the space that COVID gave them.
And spending more time with your kids is a good thing as well too, even though sometimes that can be a bit stressful. But you know, being able
It
to spend,
is.
isn't it?
It is. I think that a lot of families had time together to enrich their relationships. They spent time together, they ate meals together, they went for hikes. I do think people reconnected with their hobbies that they'd never have time to do. I think people reconnected with nature. I think everyone slept a little bit more. People connected with food and food sharing within family. So those are really good things that came out of it. And again, I really hope that people can take what they felt in May and turn it into some positive change in their life moving forward, because a lot of people around September, you know, all of a sudden people just wound things back up and got back to a bit of normal, especially in communities where COVID isn't very big in numbers. So I hope that everyone can kind of take hold of the feelings they had in May when they felt like life was slower and actually apply that to their moving forward culture of their family.
So what can we do to stay healthy as possible through COVID? Some practical guidelines. I know people are waiting around for a vaccine. People are waiting for herd immunity, and no one ever really talks about what we can do. And the one thing that is a strong aggressor to these viruses is our immune system.
Right.
And what can we do to build our immune system? Because as we get older, we all know that our immune system gets compromised, and so what are some of the guidelines, practical things that people can do that they don't have to wait, because who knows when a vaccine will be available? Who knows when or if people even want to take a vaccine? So what are some things we can do for that?
I think I'll preface it by saying sometimes it's a touchy subject because people say, oh, well, even healthy people get COVID. So full agreement, COVID's a weird virus. We don't really understand it fully yet. We're learning the best we can. I still believe strongly in preventative medicine and helping our bodies be as healthy as they can be in order to handle everything that comes our way, whether it's a stress, whether it's a virus, whether it's a bacteria, whether it's an injury. We all can benefit from being as healthy as we can be and dealing with prevention. So, I think that we have an opportunity with a bit of a positive movement in the food movement and communication and media around food for people to get to real food eating or whole food eating, which means really decreasing the use of processed foods. So that means foods in a package or highly processed sugar added to the foods. So that's getting rid of junk food or packaged foods and learning how to cook again and cooking from nature. So when you buy your groceries, I always say you should be able to call the things that you buy for your groceries in one word. So carrot is one word, rice is one word. Like we should know and understand where food is coming from and not have it too processed. So that's super important. I think we can add extra nutrients to our diet through supplements, and I'm a believer in the addition of supplements. I really like vitamin C, I really like vitamin D, I really like zinc, and I really like a probiotic. And if you're not having much green in your food, in your diet, if people who say, I don't like salads or I don't digest them or I don't like asparagus or broccoli, then maybe you need some powdered or liquid spirulina or chlorophyll. And you could go to your local health food store or connect with a naturopathic doctor or a holistic nutritionist and figure out how to get these green things in your diet, because green food is just very neutralizing, very nutritive, and super healing.
I've read some things about omega-3.
Mm-hmm.
Can you talk to omega-3?
Yeah, sure. So
would that be on top of the list?
It's up there. It would have been the next one I would have gone to after something green. Make sure we have healthy oils in our diet. Omega-3 is just one form of a healthy fat that we can have in our diet that's really good for cardiovascular disease, really good for lung health, good for skin and bones, basically, and inflammation, almost always anti-inflammatory. So we can get that through eating fish. We can get it through eating coconut oil, flaxseed oil, olive oil, good nuts and seeds, chia, hemp, all of those things. But we can also, if we don't feel like we're getting enough of that, we could take an omega fatty acid supplement, and that could be based from a fish oil, or it can be a plant-based omega-3. So those are really good to get as well.
Okay. And I'm picking your brain now because people who are listening can't ask you the questions. Acai berry. I've read stuff about acai berry.
It's a great one. Yeah, it's a great one. It's a great antioxidant and it's high in vitamin C. So it's a lovely dried fruit that you can have in powder form or in dried form. It could be something you sprinkle over your breakfast. So I'm a big fan of using food as a vehicle, I always say. So if you have a bowl of cooked food, whether it's oatmeal or rice, think, this is a vehicle. What can I put in it to bump up the nutrition? So if you have a bowl of oatmeal, you could put in some acai berry, you could put in some hemp hearts, you could put in some chia, you could sprinkle on some vitamin C powder. You could, I think, what else can we put in there to bump it up, to make it more nutritious for us?
As we get older, and I don't know if people realize this, but we do have more control over our health than we believe we do. Mm-hmm. I know I was talking to someone the other day, and the interaction that we had, they tended to seem to want to rely on medications to control their health rather than, because I had one person say he'd rather take a needle for diabetes 3 times a day than to lose 25 pounds. I mean, that's problematic, right? And I heard somebody else say that, I'm going to a death by chocolate or whatever. It was a dessert party. And he said, there's no problem. I'll just take an extra statin.
Right.
How do you change that mindset in people who seem to rely way too heavily on traditional medicine and not realizing that, there are other issues that come up when they take these things, where there are better, healthier alternatives?
I think it comes from our culture and what we teach our kids in school and through social media and families. And if we can start with kids when they're young with philosophies about food and health, I think that's really great. And just, trying to get through to people about how they're feeling each day, and if I can get some people to really work hard at following my guidelines for a couple of weeks, and the recognition that they feel well doing that. Some people don't realize they don't feel well,
Because they're so used to it.
or their
That's their normal.
standard,
Yeah.
their standard of what's okay is so off the mark of healthy living that it's almost mind-blowing to me. And I'm not a fan of mediocrity. I'm not a fan of setting set low for health and the way you feel. And I'm not okay with people saying it's okay, I'm getting through my life. I find that really sad. And I think that we shouldn't be getting through our life. We should really be excited and energetic and feeling pretty great about each day that comes our way.
I saw. I'm sorry. Go ahead. Go ahead.
Well, I just think people don't realize that.
Yeah, I saw a meme, and it was somebody like diving into a beautiful pond or a lake or something, and the thing on the bottom said, "Are you living or are you existing?"
Yeah.
And that's really what it comes down to, isn't it? Is it, are you living, or are you just getting through each day full of stress? I talked to a doctor who spends his whole day doing colonoscopies.
Yeah.
And one of the questions I asked him was, I said, what is probably the biggest trigger for inflammation in the body? And his answer was sugar.
Yeah.
He said, you really need to eliminate as much sugar as you possibly can from your diet, because that is a big problem. And when you look at the research really shows that cholesterol. David Suzuki did if you wanted to YouTube it, is a really good thing on the nature of things called The Question of Cholesterol. And David Suzuki he said, cholesterol really is not the issue. Inflammation is the issue. So how do we control inflammation? And I know controlling sugar is one way. I think you talked about processed foods. That's something else. What can we do to control inflammation? Because that seems to be the biggest issue for people.
Right. It is a huge issue, and it's like a catch-22 or cycle that goes around. So sugar is huge. And a side note is, as I'm looking stats of numbers of COVID cases just for my own personal research and finding out where around the world, how many deaths due to COVID, it's just fascinating. Since March, I've been really paying attention to what's the major cause of death in the world, and it's diabetes by a long shot, which is unbelievable, really. And I think that so that's a side note, but sugar will lead to inflammation. So we all need to stop or decrease the amount of sugars that we're having in our day. And that's not fruit sugar, that's processed white sugar or baked, foods that we're buying that are coming in the house with lots of sugar in them. Stress is a huge influencer on inflammation, because when we get stressed, we put out some hormones and chemicals in our body that our body thinks we're in an emergency situation. So the way we process and break down sugar in that moment and store sugar, it really affects the way our whole biochemistry works with cholesterol and with inflammation, because our body stores all the sugar then when we're in a stress mode. So we're finding that people are in a bit of a low grade stress mode all day. So we're just storing chemicals and storing sugars that we shouldn't be storing, that influence our blood sugar, influence our inflammation, influence our energy. So stress is a big one. Sugar is a huge one.
Kathleen, we're almost out of time. Again, thank you very much for taking the time out of your busy day. Can we end off, and can you leave our listeners with something that they can use today to move them in the right direction of health?
So I guess something I find quite powerful is that I always say my patients who are the most compliant are the patients that have been told something quite horrific about their health. So patients who have been given a diagnosis of something quite serious listen to everything I say and do everything I tell them to do, which is wonderful because they're afraid and they're all of a sudden presented with a very scary ideology of what's happening in their life and how much time they have and what the
Mm-hmm.
quality of their life is going to be.
Mm-hmm.
So I always say if we could bottle that and somehow influence people who are healthy to apply those ideas early so that we can feel really good and prevent a lot of the things that potentially could happen to our health. Our older selves will be thanking ourselves for, listening to that information.
Thanks, Dr. Kathleen. As you're listening to this, Kathleen's information is up there, her contact information, her bio. There's a lot that I didn't include in her bio because I would need 3 or 4 pages to list all of her qualifications. But again, if you feel as though you're not living, you're existing, and if you have struggles getting through each day, Kathleen has 2 practices, one out in Bay Roberts, and she also works out of Winter Home. Feel free to give her a call. It could be probably one of the best phone calls you've ever made for yourself in your life. Again, Dr. Kathleen, thank you very much. I really appreciate the time you've taken to enlighten us with your wisdom and knowledge.
Oh, thanks, Gary. I really appreciate it as always.